This is the intervention presentation and capstone video reflection. My name is Devona Cruz in NURS FPX 4900 Capstone Project for Nursing. The school is Capella University. My professor is Susan Pantano. In this section, I will discuss the interview and practicum or slash practicum with my selected patient. This is the summary of my patient. Ellen is a 65-year-old female, recently widowed from her husband of 40 years and currently living at home alone. I believe she is relevant to the defined health problem due to her diagnosis of type 1 diabetes, which is what my capstone project is about. In the beginning of the interview, Ellen was reluctant to speak about her diagnoses. She was diagnosed in her mid 30s, and according to Ellen, her mother has type 2 diabetes and doesn't know if anyone else in her family has it. Her medical history consists of diabetes, controlled hypertension, arthritis, and obesity, according to her BMI of 33.7 for her height of 5 feet 3 inches and weight of 190 pounds, with a recent weight loss of 130 pounds in 5 months. Meeting dates were September 5th for 2 hours, September 7th for 2.5 hours, September 8th for 2.5 hours, September 9th for 3 hours, which brings us to a total of 10 hours. The location meeting was in her house. Describe the problem you were addressing, which was inadequate diabetic self-management education. Why was this a problem for the patient? The patient had a diagnosis of type 1 diabetes that was uncontrolled. The patient lives alone and needed more guidance and education on the disease process. According to the patient, she would skip meals to not use insulin, but it would backfire at times because she ends up binge eating and doubling up on insulin sometimes. What was the intervention? My intervention was self-management and education on diabetes. How will the patient apply the intervention? After showing the different websites for smart tech provided by the government, her daughter assisted by applying online and calling to see how she can gain access. She also made an appointment to consult with a nutritionist to assist in a modified diet to her liking. I told her we could apply for the gym membership whenever she is ready, if interested. No pressure. Small steps at a time. We also discussed better use of her insulin and not skipping meals. How often will the intervention be used and under what circumstances? I believe certain ones are ongoing or daily and will take time for her to get used to. How easy was it for the patient to get used to the intervention? Getting in contact with someone about upgrading her phone took some time and assistance. I think meal monitoring and insulin re-education will not be difficult, just a step-by-step process to get used to. I do not expect her to adjust to everything all at once. New habits take time to keep, as well as breaking the old ones. Describe any challenges associated with the patient use of the intervention. I think monitoring her blood glucose will be difficult. I believe an automated device will be better for her. Were instructions necessary once she gets the new devices? Yes. What did the patient say about using the intervention? She's excited to try something new and keeps saying, I hope this works. Was the intervention helpful? According to the patient, a lot has changed since her initial diagnosis and didn't have so many helpful options available. How will the patient continue to use the intervention? She will continue to monitor her blood sugar levels and become better acquainted with the telehealth. Explain how the intervention positively or negatively affected the patient's life. I believe it positively affected her by making the healthcare team more accessible and getting her an automated blood glucose device. How can the effect be measured? blood work on her A1C, weight loss, and overall management of her health. Evidence and peer-reviewed literature to plan and implement a capstone project. Taken from Wiley Author Services, peer-reviewed is intended to evaluate the reliability, excellence, and frequent originality of papers before they are published by eliminating inaccurate publications or of low quality. Its principal goal is to preserve the integrity of science. Peer review services as a content filter from the standpoint of a publisher, sending higher quality articles to higher quality journals and thereby developing journal brands. Peer review is valuable procedure that gives papers more worth. Publishers must ensure that peer review is thorough. According to the Nursing Journal .org website, nursing students can apply what they have learned into practice in capstone courses, which serve as a transition between the completion of school and the start of a profession. As the name implies, capstone projects are finished by students near the end of their nursing education. While a capstone is not necessary for all programs, those that do usually lead to a bachelor's in nursing or a doctor of nursing practice degree. Students can use research and practical evidence to address a health care issue because to the emphasis on evidence-based practice, candidates can, for instance, create intervention plans that support patient safety, enhance the quality of life, and promote health. This is taken from capstone projects for nursing programs in the Nursing Journal. The application of knowledge acquired during nursing training programs include subjects like leadership, management, research theories, and evidence-based practice, as well as the techniques required to move from being students to bachelorette level nurses are the main focal point of capstone projects, also taken from capstone projects for nursing programs in the nursejournal.org. Capstone project outcomes match one's initial predictions. The capstone project outcome matched my initial prediction and more. After interviewing the patient for 10 hours, I had to modify the interventions a few times because of the patient's omissions in medical history. It took time for her to be more open, and I see that I was trying to help and not criticize her lifestyle, just improve it. Health information and patient care technology to improve patient and system outcomes. During an interview with the patient, I asked if she ever used telehealth. She informed me that she only used it a few times during the pandemic, but did not like it because her phone isn't up to date and she doesn't own a tablet or laptop at this time. Later on in the capstone interview, I researched a few government programs that allow people on Medicare and seniors to receive free smartphones with plans, free tablets, and free to low-priced broadband. I informed Ellen this would allow the providers to communicate face-to-face with her more frequently and save her a trip to the office. According to Harvard Business Review website, many people, given the technology to do telehealth face-to-face, may not have digital illiteracy. Ira and Oak Street introduced practice visits in which administrative staff conducts a mock video visit with patients 1 to 2 days before the first video with the clinician. Both healthcare professionals and patients agreed that the practice visits significantly increased the success of the actual video visits. To help patients use its video app, Landmark employs healthcare ambassadors, skilled community health workers. Patients are visited at home, assisted with downloading and setting up the app, and multiple test video visits are then conducted. And this is taken from 4 Strategies to Make Telehealth Work for the Elderly Patients, 2020. I also discussed a different device used to monitor and record blood sugar. According to Healthline website, a non-invasive CGM can also assess your glucose if you're seeking a blood sugar monitor that doesn't require you to prick your finger. Depending on the sort of meter you select, you might need to wear sensors or various parts of your body and replace them after a set period of time. Analyze the impact of health policy on quality and cost of care. Taken from the University of St. Augustine, a crucial component of the American health system, healthcare policy works to maintain and shape population health and well-being. Access, pricing, delivery, and privacy in healthcare are essential issues that are impacted by policy. It involves the laws and policies that are enacted at the local, state, and federal levels by legislators. And this is taken from University of St. Augustine, 2021. During many of my assessments throughout Capella University, I researched health policies such as HIPAA and Affordable Care Act. Taken from the U.S. Department of Health and Human Services website, the HIPAA privacy rule, which is applicable to health plans, healthcare clearinghouses, and healthcare providers who engage in specific electronic healthcare transactions, establishes national standards to safeguard patient medical records and other individually identifiable health information. The rule establishes the limitations and requirements on the uses of disclosures of protected health information that may be made without a person's consent. And then we have the Comprehensive Health Care Reform Bill, and its revisions are often referred to as the Affordable Care Act. The law targets preventative care, health care expenses, and health insurance coverage. These policies influence the information I researched about the patient's health insurance. For example, Medicare covers certain preventable health care expenses such as gym memberships. Contribution of my intervention to patient satisfaction and quality of life. At first, my patient was reluctant to speak with me about health concerns and conflicts because of the fear of being judged and criticized. We all have different eating habits and cultures that need to be considered when planning patient care. I would not expect this patient of a Caribbean background to change all of her food preferences from her culture. Goals are made to be attainable for the patient, always keeping them in mind. When I presented information about diabetic care, I went over what she already knew and added new information to it, making sure the patient didn't feel completely in the dark about her health. Communication and presentation of materials can influence or deter a patient from implementing interventions. We discussed care coordination, which involves the deliberate organization of patient care tasks and information sharing among all patients, of all parties, involved in a patient's care in order to provide safer and more efficient care. Taken from Agency for Healthcare Research and Quality, 2018. We also discussed updated smart tech and how to obtain them. Overall, she was receptive to the material presented. Personal and professional growth throughout a Capstone project and the RN to BSN program. Undergraduate research is a high-impact activity that gives students the chance to significantly advance their fields of knowledge. Hugh et al. 2008, blue, right, pointing triangle. According to research on the benefits of undergraduate research, students' communication, critical thinking, and problem-solving skills have generally improved. There has also been an increase in student satisfaction and frequently of faculty-student interactions, both of which are related to student success. Weaver et al. 2016. Each nursing program establishes its own specifications. While capstone presentation styles vary amongst programs, they often include a formal paper or presentation that is based on evidence. Students may serve as team captains for their capstone projects, and BSN candidate may speak before a faculty panel about their papers. Case studies, program assessments, and policy analysis are some examples of projects taken from capstone projects for nursing programs. My personal experience with Capstone was very interesting because I did a lot of research on this patient. I have worked with this population for quite some time, but I must say you still will learn something new while researching. I learned about the community resources available to help with giving seniors smartphones and tablets so they are able to use telehealth at home. Throughout my studies in the nursing classes, I have much to think about when it comes to leadership as a nurse and the new roles I can take on gaining my BSN. I still have more experience to gain to improve on my communication skills and becoming a better advocate for my patients. One thing with the medical field is it's continually learning experience to educate and improve on clinical and critical thinking skills. The education gained through Capella University will help continue on my journey to improve myself. Thank you.